Imagine walking into your barn one morning, maybe you're a farmer, and you see a heifer acting. Well, strangely. Staggering, confused.
Almost like it's drunk, yeah. It's a disturbing sight, definitely.
Exactly. And it really highlights how, on a farm, seemingly innocent things can hide really deadly secrets.
Absolutely. Things you might not even think twice about normally.
Which brings us perfectly to our deep dive today. We're tackling a really serious and unfortunately often fatal condition, ethylene glycol toxicity in cattle.
It's a crucial topic. Causes real devastation when it happens.
Right. And our mission here, is to take all this source material we've gathered, articles, veterinary reviews, our notes, and really pull out the key nuggets of knowledge.
Get to the heart of it, yeah. Distill it down.
Yeah, understand not just what it is, but how cattle actually get exposed, how this silent killer works inside their bodies.
The whole mechanism, and then how it's diagnosed, which is tricky.
Diagnosis, and maybe most importantly, prevention. Because the impact, both for the animal's welfare and economically.
Oh, it's profound. It really can be devastating for a cattle operation. Significant losses.
So let's start at the beginning. What exactly is this main character, ethylene glycol, or EG?
Right, EG. Well, fundamentally, it's a synthetic liquid alcohol. It's clear, has no odor.
Okay.
But here's the critical part. It has a distinctly sweet taste.
Ah, sweet. That sounds like trouble already for animals.
Exactly, that's the lure. You find it mainly in automotive radiator antifreeze, sometimes up to 95% concentration.
Wow, 95%.
Yeah, potent. But it's also in de-icing solutions, other coolants, even some industrial solvents.
So how do cattle typically run into this stuff in a farm setting? It seems like it should be avoidable.
You'd think so, but exposure happens in several common ways. Improper storage is a huge one.
Like just leaving containers around.
Exactly. Antifreeze jugs left open, maybe not sealed properly, or just stored in places animals can easily access. Barns, sheds.
Okay, makes sense. What else?
Equipment leaks are another big source. Think about puddles forming under tractors, trucks, other farm machinery with cooling systems.
Right, those little drips you might ignore.
Those drips can be deadly. And then there's improper disposal. People pouring used coolant onto the ground.
Oh, definitely don't do that.
No. It contaminates the soil, creates standing pools cattle might drink from. We've even seen documented outbreaks linked to contaminated water sources.
Really? Like what?
There was a notable case involving something called molasses washout water, an industrial byproduct that got contaminated with EG somehow.
Wow, so it can even get into feed or water indirectly.
It can. And sometimes it's specialized equipment, too. Leaks from solar collectors on the farm, heating systems, even things like ice rink freezing equipment, if that's nearby.
That's a wider range than I initially thought. Is there a time of year this is more common?
Yes, definitely. We tend to see a peak in incidents during the fall, winter, and early spring.
Why then?
Well, that's typically when people are servicing their vehicle cooling systems, right? Changing antifreeze, checking levels. More handling means more chances for spills or improper storage.
So it's that cruel irony. Again, the very sweetness that makes it attractive to them is what makes it so incredibly dangerous.
Precisely. It's a deadly combination of palatable and toxic.
But you mentioned earlier, it's not just the ethylene glycol itself that's the killer. It's what the body does with it. Can you unpack that, this lethal synthesis?
Absolutely. That term, lethal synthesis, is key. It means the parent compound, the EG you swallow, isn't the main problem. It's the toxic byproducts the body creates when it tries to break it down.
Okay, so the metabolism itself is the issue.
Exactly. Once ingested, EG is absorbed incredibly fast from the gut. It hits peak levels in the blood within just, say, 1 to 4 hours.
That fast. Wow.
Super fast. And that speed is why trying to decontaminate, like making an animal vomit, which you can't really do effectively in cattle anyway, or giving activated charcoal, is usually too late.
So those methods are basically off the table unless you catch it immediately.
Pretty much, you'd need to act within maybe an hour, which is hardly ever practical.
Right.
The crucial action happens in the liver. There's an enzyme called alcohol dehydrogenase, or ADH.
CDH, okay.
This ADH enzyme starts metabolizing the EG into something called glycolaldehyde. Now, this step is actually the slowest part of the whole toxic process.
Which makes it important.
Very important because it's the rate-limiting step, and it's the primary target for the antidotes we use.
Antidotes target that enzyme ADH.
Correct. And interestingly, that same ADH enzyme has a much, much stronger attraction, like 100 times stronger, to ethanol, regular alcohol.
Than it does to ethylene glycol.
Exactly. And that preference is the entire scientific basis for using ethanol as an antidote, believe it or not. It competes for the enzyme.
Fascinating. Okay, so ADH makes glycoaldehyde. What happens next in this toxic cascade?
Right, so that glycoldehyde is quickly converted into glycolic acid. And the buildup, the accumulation of this glycolic acid is what causes a really severe high anion gap metabolic acidosis.
Meaning the blood gets dangerously acidic.
Dangerously acidic, yes. So pH, low bicarbonate. It throws the whole body chemistry off balance. But it doesn't stop there.
There's more.
Oh, yes. That glycolic acid gets further metabolized, eventually becoming oxalic acid. And this is the ultimate kidney toxin.
Oxalic acid. Why is it so bad for the kidneys?
Because oxalic acid loves to bind with calcium in the body. It combines with ionized calcium to form these tiny, insoluble crystals, calcium oxalate crystals.
Crystals. Inside the kidneys.
Inside the kidney tubules, yes. These crystals precipitate out. They literally clog up the microscopic filtering tubes.
So they cause a blockage?
A physical blockage, yes. But they also cause direct cytotoxic damage. They kill the kidney cells. This leads straight to acute kidney injury and ultimately renal failure.
And you can actually see these crystals.
You can. Finding specific shapes of these crystals, sometimes described as picket fence or spindle-shaped monohydrate crystals in the urine under a microscope, is considered almost definitively diagnostic. Pathognomonic, we call it.
Wow. So just to summarize this, an animal drinks the sweet EG, it gets absorbed super fast, the liver's ADH enzyme converts it, creating toxic acids that make the blood acidic, and then creates oxalic acid, which forms crystals that physically destroy the kidneys.
That's a perfect summary of a truly brutal internal process. A chilling chain of events, as you said.
It really is. Now, something else that struck me in the research was how this poisoning seems to follow a predictable pattern, like distinct stages over time. That sounds critical for anyone trying to recognize it.
Absolutely vital. Ethylene glycol toxicosis in cattle does follow a fairly predictable time-dependent course, generally broken down into 3 stages.
Okay, what's stage 1?
Stage 1 is the neurological stage. This usually hits within about 30 minutes to 12 hours after they drink the EG.
So pretty quick.
Very quick. This is caused by the direct depressant effect of the unmetabolized ethylene glycol itself on the central nervous system. It acts a bit like alcohol poisoning.
So like that drunken staggering we mentioned at the start?
Exactly. You see ataxia, that staggering gait depression, lethargy, muscle twitching, general weakness. Sometimes it progresses to posterior weakness or paralysis, so the animal goes down and can't get up.
Any other signs in this stage?
Yeah, you might also see nausea, maybe some vomiting, though less common in cattle, excessive salivation, and importantly, polyuria, increased urination, and polydipsia, increased thirst.
Why the increased drinking and urinating?
It's an osmotic effect. The EG molecule pulls water into the urine, so they pee more, get dehydrated, and then drink more to compensate. It's the body trying to flush it out.
Okay, neurological signs, drinking, urinating, seems fairly clear.
Well, here's the really treacherous part of stage 1. There can often be a period of apparent recovery.
Apparent recovery? What do you mean?
The animal might seem to get better, perk up a bit, look brighter, more stable.
That sounds dangerous.
It's incredibly dangerous because an owner might see this improvement and think, oh, maybe it wasn't serious or it's getting better on its own. They delay calling the vet.
And they miss the crucial window for treatment.
Precisely. They miss that narrow time frame, maybe the first 4 to 8 hours, where antidotes can actually work effectively.
So that false improvement is a major pitfall. What happens if they miss that window and it progresses?
Then we move into stage 2, the cardiorespiratory stage. This typically occurs between 12 and 24 hours after ingestion.
And what's driving this stage?
This stage is primarily driven by that severe metabolic acidosis from the glycolic acid buildup we talked about.
Right, the acidic blood. How does that affect the heart and lungs?
You'll see tachypnea, really rapid, deep breathing. Sometimes it's called Kussmaul respiration. It's the body's desperate attempt to blow off excess carbon dioxide to counteract the acid.
Trying to compensate.
Exactly. You'll also often see tachycardia, a rapid heart rate, potential cardiac arrhythmias, and maybe even pulmonary edema fluid in the lungs. Plus, the hypocalcemia, the low calcium from the oxalate binding, can also contribute to muscle tremors and those heart rhythm problems.
Okay, so stage 2 is acidosis hitting the heart and lungs hard. What's stage 3?
Stage 3 is the renal stage. This usually manifests between 24 and 72 hours post-ingestion. And frankly, this is typically the final fatal stage.
Because the kidney damage is done by then.
Exactly. It's the result of severe acute kidney failure caused by widespread death of the kidney tubule cells and all those crystals depositing.
What are the signs now?
The key sign is a dramatic decrease in urine output that's oliguria, which often progresses to anuria, meaning no urine output at all.
Yeah.
The kidneys are shutting down.
Total kidney failure.
Total kidney failure. You'll see azotemia, high levels of waste products like BUN and creatinine in the blood. You get uremia, the systemic signs of kidney failure, oral ulcers, severe depression, complete loss of appetite, potentially seizures, coma, and then death. The kidneys themselves might feel enlarged and painful if you palpate them.
That's a truly devastating progression. Understanding those stages, especially that deceptive recovery in stage 1, wow, it really hammers home the urgency.
It does. Acting fast, even if the animal seems to rally, can literally be the difference between life and death. There's no time to waste.
Okay, so recognizing the signs is critical. How does a vet actually diagnose this, especially given how fast things change?
Diagnosis requires a high index of suspicion, first off. You have to think of it. And then it's about rapidly putting together the puzzle pieces. The history, the clinical signs, and specific lab tests. Because it's so dynamic, timing is everything for the tests.
So what are the key pieces? History first.
History is paramount. Sudden onset of those neurological signs, the staggering, depression, especially if there's any known or even possible access to antifreeze. That triphasic progression we just discussed is also a huge clue if the timeline fits.
Right. What about lab tests? What can they tell us, and when?
Okay, early on, say in the first 12 hours, measuring the osmolar gap in the blood can be very useful.
Osmolar gap, what's that?
It's basically a measure of unmeasured substances dissolved in the blood. Ethylene glycol is one such substance. So an elevated osmolar gap suggests something unusual, like EG is present before it gets heavily metabolized. It's a transient clue, though.
So it disappears later.
Yes, as the EG gets broken down. We can also directly measure serum ethylene glycol levels in that early window, 0 to 12 hours. That confirms exposure.
But getting those results takes time.
Often, yes. It usually requires sending samples to a specialized lab, so turnaround can be slow, which isn't ideal given the urgency.
Okay, what else? Urine tests.
Urinalysis is very important. You can start seeing those characteristic calcium oxalate crystals, the picket fence or dumbbell shapes, as early as 3 to 6 hours after ingestion.
That early. That seems like a key diagnostic marker.
It is. Seeing those crystals is highly suggestive. Later, as kidney damage occurs, you'll also see things like blood in the urine or the urine becoming very dilute, isostenuria, because the damaged kidneys can't concentrate it anymore.
And blood tests for the acidosis.
Absolutely. Blood gas analysis is crucial. It will show that severe high anion gap, metabolic acidosis, low pH, low bicarbonate, and anion gap typically way over 25. This usually becomes evident after about 6 to 12 hours.
So after the osmolar gap might start to normalize, the acidosis kicks in.
Exactly. And then later still, especially after 24 hours when stage 3 is setting in, your standard blood chemistry panel will show the signs of kidney failure. Markedly elevated creatinine and BUN, that's the azotemia. You'll also typically see low calcium, high potassium, and sometimes high blood sugar.
So it's a combination of history, signs, and timing the right tests.
Precisely. You integrate everything. And of course, in fatal cases, a post-mortem examination provides definitive proof.
What do you see post-mortem?
Grossly, the kidneys often look pale, swollen, maybe some hemorrhages. But the definitive diagnosis comes from histopathology looking at kidney tissue under a microscope. You'll see widespread tubular necrosis, the dead kidney cells, filled with abundant calcium oxalate crystals that shine brightly under polarized light.
Okay, so diagnosis is possible, but challenging. Let's talk treatment. You've hinted it's tough. Why is effective treatment so difficult in cattle?
Yeah, it's incredibly challenging, bordering on futile in many cases, especially if not caught very early. As we discussed, decontamination is usually ineffective because absorption is so fast, vomiting isn't an option, and charcoal doesn't bind EG well.
So you can't really get it out once it's been ingested.
Not easily, no. Which brings us to antidotal therapy, trying to stop that lethal synthesis pathway.
Right, targeting the ADH enzyme.
Exactly. But again, the timing is critical. Antidotes are generally only effective if started within the first 4 to 8 hours before a lethal amount of those toxic metabolites, especially glycolic acid, has formed.
And what are the options for antidotes?
Well, for humans and dogs, the preferred antidote is a drug called fombazole, or 4-MP. It directly inhibits the ADH enzyme and is very effective with fewer side effects.
Sounds great. Why not use that in cattle?
The main barrier is the cost. It's prohibitively expensive for use in large production animals like cattle. Plus, we don't actually have well-established validated dosage protocols for cattle specifically.
So fomepizole is basically out for practical purposes on farms. What's left?
That leaves us with the older antidote. Ethanol. Plain old alcohol.
Alcohol? How does that work again?
Remember how ADH prefers ethanol much more strongly than EG? You basically flood the system with ethanol, usually given intravenously. The ADH enzyme gets busy metabolizing the ethanol instead of the EG.
So it competitively inhibits the breakdown of EG.
Exactly. It buys time for the unmetabolized EG to be excreted by the kidneys, hopefully before it turns into the really toxic stuff. It's a practical, much more affordable alternative.
But I sense a but coming.
Oh, there are significant disadvantages, especially in cattle. First, like fomepizole, we lack validated species-specific dosage protocols. Vets have to extrapolate, which isn't ideal.
So dosing is tricky.
Very.
Where?
And it requires intensive, constant monitoring. You need to maintain a specific therapeutic blood ethanol level, usually between 150 milli-GDL. Too low, and it's ineffective. Too high.
What happens if it's too high?
Then you risk severe side effects from the ethanol itself. Profound CNS and respiratory depression, hypoglycemia or low blood sugar. And it can actually worsen the metabolic acidosis you're already fighting. It's a difficult balancing act.
So ethanol is an option, but a risky and labor-intensive one.
Extremely. And beyond antidotes, you absolutely need aggressive, supportive care.
Like what?
Aggressive intravenous fluid therapy is crucial to correct dehydration, help flush the kidneys, and promote urine production. If the acidosis is severe, you might give intravenous sodium bicarbonate carefully.
And what about the low calcium?
If the animal shows clinical signs of hypocalcemia, like muscle tremors or twitching, you might give intravenous calcium gluconate, but very cautiously.
Why cautiously?
Because adding more calcium when oxalic acid is around could potentially lead to more calcium oxalate crystal formation in the kidneys, worsening the damage. It's another fine line to walk.
This all sounds incredibly complex and challenging. What's the reality once an animal reaches stage 3, the kidney failure stage?
The grim reality is that once an animal is azotemic, with high BUN and creatinine, and especially if they have oliguria or anuria, little to no urine output, the kidney damage is extensive and generally considered irreversible.
So treatment is unlikely to work then?
At that point, antidotal therapy is no longer effective because the toxic metabolites have already done their damage. And advanced treatments like hemodialysis, which might be used in humans or sometimes small animals, are just not practical or economically feasible for cattle.
So the prognosis overall sounds not great.
It's typically described as guarded to poor, even with early intervention. Once azotemia and clinical signs of kidney failure develop, it becomes grave.
Grave, meaning survival is highly unlikely.
Highly unlikely. The chances diminish rapidly with every hour that passes before treatment. And certain signs, like severe non-responsive metabolic acidosis, profound CNS depression, or coma or seizures, are all very poor prognostic indicators. Recovery is rare in those cases.
Wow. Okay, if we connect all this back to the bigger picture, given the speed, the diagnostic hurdles, the treatment difficulties, the awful prognosis, it really seems like prevention isn't just important, it's everything.
It is the cornerstone. It's the only truly effective strategy for managing ethylene glycol risk in cattle. Everything else is often too little, too late.
So how do we shift the mindset around prevention?
I think a crucial shift is needed. We need to stop viewing these poisoning incidents as just isolated, unfortunate accidents,
Right, see them as
symptoms of systemic deficiencies in how hazardous materials are managed on the farm overall. It calls for a much more comprehensive, proactive, system-wide approach to chemical safety, almost like a HACCP plan for hazardous materials.
a HACCP plan, like for food safety, but applied to chemicals, identifying critical control points.
And that kind of proactive, preventative thinking. Identify the risks, implement controls.
So what are the absolute critical prevention strategies for producers and farm managers? What should they be doing right now?
Number one, without a doubt, is secure storage. All products containing ethylene glycol antifreeze coolants must be stored in their original, clearly labeled, tightly sealed containers.
Not just left on a shelf.
No. Stored in a secure, preferably locked, area that is completely inaccessible to any livestock. No exceptions.
Okay, secure storage. What's next?
Equipment maintenance. Implement a regular, routine schedule for inspecting all farm vehicles and any stationary equipment with cooling systems for leaks. Check hoses, radiators, connections.
And fix leaks immediately.
Immediately. Don't let puddles form where animals can access them. Third is spill management.
Cleaning up spills properly?
Thoroughly and immediately. Use inert absorbent materials, things like kitty litter, sawdust,
Yeah.
sand to soak up any spill completely. Then carefully collect all that contaminated material and dispose of it properly. Don't just hose it away.
Right. Those are crucial controls. Is there anything else proactive they can do?
Yes, a really big one. Consider using safer alternatives.
Like different types of antifreeze.
Exactly. Strongly recommend switching to propylene glycol-based antifreeze products whenever possible.
Propylene glycol, how is that different?
It's significantly less toxic. It doesn't undergo that same lethal synthesis pathway in the body that makes ethylene glycol so deadly. It still requires careful handling, but the risk of fatal poisoning is dramatically lower.
That seems like a really straightforward way to reduce risk significantly. Just switch products.
The major risk reduction step, yes.
Yeah.
Simple substitution.
And the economic argument must be pretty strong too, right? The cost of prevention versus losing animals.
Oh, absolutely compelling. Think about it. A single poisoning incident could easily result in the loss of multiple valuable animals. Breeding stock, feeder cattle. That financial loss far, far exceeds the minimal cost and effort involved in implementing robust prevention protocols like secure storage, leak checks, and maybe switching antifreeze type.
It's a clear return on investment in safety.
Unquestionably. And related to spills and storage is proper disposal of used antifreeze. This is critical.
What shouldn't people do?
Never, ever dump used antifreeze onto the ground. Don't pour it into storm drains, septic systems, or any waterways. That's environmentally irresponsible and often illegal.
So what are the approved methods?
You need to collect all used antifreeze in sealed, clearly labeled containers. Then transport it to a designated hazardous waste collection facility. Many municipalities have them. Or use a licensed hazardous waste contractor, especially for larger volumes.
Okay, responsible disposal is key.
Essential. And really, all of the storage, handling, spills, disposal, safer alternatives should be formally integrated into a written on-farm biosecurity and safety plan.
A written plan that everyone knows.
Yes, documented protocols. And it needs to include training for all farm personnel who might handle or work near these substances. Everyone needs to understand the risks and the procedures.
That makes perfect sense. A systematic approach.
It's the only way to truly manage the risk effectively long-term.
Okay, let's try to briefly recap the key takeaways from this deep dive. Ethylene glycol toxicosis in cattle. It's clearly a severe, incredibly rapidly progressing, and sadly often fatal condition.
Driven by that complex, lethal synthesis inside the body, turning something sweet into acids and kidney-destroying crystals.
Right. And while there are distinct clinical signs, those 3 stages we talked about, and diagnostic tools exist, the narrow treatment window, the practical challenges with antidotes in cattle,
make effective treatment incredibly difficult, and the prognosis is often just grim, especially once kidney failure sets in.
which really brings it all back to that central point. Prevention is paramount. Secure storage, leak management, proper disposal, considering safer alternatives like propylene glycol.
That comprehensive, systematic approach to chemical safety is the only reliable defense.
It truly is. Which leaves us with a final thought for you, our listener, to maybe mull over. This raises an important question, I think. How can these principles we've discussed today, systematic chemical safety, proactive risk mitigation for ethylene glycol, how can they be applied more broadly?
To other hazards.
Yeah, to other potential chemical hazards on a farm or maybe even in our own homes. How do we move from just reacting to problems towards building these proactive, comprehensive safety strategies for all sorts of potential dangers?
That's a great question to ponder. Moving from reactive to truly proactive safety culture.
Something to think about. Thanks for joining us on this deep dive.